This session with 4 presentations is about the innovative technologies and platforms that we have developed during HEDIMED for the exposome research. We will start with presentation of Loïc Burr and Silvia Demuru, who come from the Centre Suisse d'Électronique et Microtechnique, CSEM, Switzerland. And they will present a portable fluorescence biosensing tool developed during the project and designed for allergen screening. So Loïc and Silvia, please.
Thank you very much. Yes, so it's our pleasure today to present the results of our work during this HEDIMED project. And what we have been working on is, as you just mentioned, a portable fluorescence reader for screening allergens, also with the assay that is coming to it. Maybe before going into too much details, quick introduction. What is Switzerland? We are a technology innovation center, and our main role in Switzerland is to develop novel technology and to transfer them to companies so that they put it into products. We are spread all around Switzerland to serve our local customer, and we are now about 600 people covering a broad range of application in the life science, in the medical field, but also in the sustainability like solar panels or batteries. And I will have the pleasure today to present with Silvia, that was the main person working on this project. Allergies, I guess there is no need to go too much in depth into what it is, because many people are concerned by this disease, about 30 to 40%, but in Europe even more. And now with the increasing air pollution and global warming, it's increasing even further. So there is here a big need to develop new technologies. But what can technology do for allergy screening? Actually, the World Allergy Organization already provided with some insights into how technology can support the allergy screening, but also making therapies better. And one of the key point is that we need to have a preventive approach and also emphasize the importance of continuing the research to better understand what is causing allergies and how to manage the allergies. And therefore, we need to develop an increased accessibility to diagnostic and therapies, and therefore also improving how the diagnostic is done and how it can be followed up on the people. How does it work right now? It's actually a fairly simple test. One put a drop of allergen on the skin, put a small prick, punch the skin, and check if there is an allergic reaction to the skin. So this is a very simple test. It's very efficient, very cost effective, but it has to be done by the specialist, which limits the number of tests one can do and also lead to very long lead time to access the test and very high cost in the end. And as well, when one wants to scan through a large number of allergen, it can start to be a bit cumbersome. So an alternative to this is screening through blood, and there the laboratory are going to analyze the IgEs, which are immunoglobulin that are specific to different allergens. And for that, we need some blood that will be shipped to the laboratory. And after some days and quite a lot of money, one gets the results back to the doctor. This is the second standard process, but what we want to bring here as a solution is a system that is much faster and much more efficient. And therefore, our proposition here was to switch to a physician model, where the physician in his office has a tool that allows him to make a test from a finger prick, so a single drop of blood on the finger, and to run the test within a few hours, having the results directly on site and directly providing the patient with the right medication. And this, of course, should be led at a very low cost. So how do we plan to implement that? What we have been working is exactly on developing an assay in a microfluidic cartridge and developing the reader that allows to read this assay at the same time. Silvia is actually going to detail this in more detail in a few minutes, but how does it work? The doctor will have a little box and a little slide. He will put the drop of blood in the slide, insert it in the box, and wait for the result on his computer. And now Silvia will detail a bit more what is the science behind this technology.
Yes, thank you, Loïc. So, going into the technology, how does this fluorescence sensing for allergen screening work? So you can see here the technology that we developed. It consists on the left on a microfluidic chip. So it's just a simple small chip where inside we can add very small amount of allergens. These are standardized allergen extracts. So once we flow into the microfluidic slide the sample of our patient, the blood sample, in case that the patient has allergen sensitivity, so EG-mediated sensitivity, we can then detect for that particular allergen the EG complex forming on the slide, thanks to the use of anti-EG antibodies with a fluorescence label. And we can actually quantify this fluorescence coming from the EG, thanks to the use of our custom portable reader that we developed for the HEDIMED project. So we just insert the slide, and then with this tool, we can acquire the image. As you can see here, this was acquired with our system, where is present, as you see, some spots with a particular intensity. This is dependent on the EGE that interacted with the allergen. So we can actually provide a quantitative signal depending on the potential allergic response or EGE sensitivity. So how does the technology compare to commercial systems? So commercial fluorescent reader in the market, you can see one here. So these tools are normally very sensitive, such as the one here, but also quite bulky and costly. So within this project, we instead develop a reader which is actually much smaller, as you can see here, with a more or less in scale comparison. It's about 20 times smaller than standard commercial readers, and also about 40 times less expensive. The price of the components for such a tool that we developed is about 1,500 euros, while commercial tools are about 60,000 euros. So while of course this portability impacted also the performance, you will see also in the next slides that it works for our application. And also we developed custom software to easily acquire the fluorescence image and quantify the images with the portable readers. So you log in, you can take the image of the slide, as you can see here. It automatically extracts the position where the allergen was present, automatically extracting the intensity of the fluorescence. And then finally, you can export these results in different formats, such as Excel file, for instance, where you have a customized template where there are all the different allergens deposited versus the fluorescent intensity, and so the EG response. And we demonstrated these with real serum sample. These samples were already measured, confirming the presence of EG-specific antibodies for some allergens that we also tested. For some of these, it was confirmed. And we tested these with our assay and also the different readers, both on the left, the commercial system, and on the right, our miniaturized portable reader. And you can see that in both cases, we have a very high signal for a particular allergen, demonstrating that we can effectively quantify low concentration of EGE with our portable system with comparable performance of a commercial tool. So Loïc, I give you back the floor now for the conclusion.
So thank you. Yes, so what we just have seen is that the technology we developed allows us to screen very easily and very efficiently allergens. We demonstrate this with a very limited number of allergens, but it can be expanded to a very large number of allergens. And this technology also has a very low cost. So it's something that has a huge or will have the potential to impact significantly the healthcare system and reducing the cost and allowing, with the portability of the system, to test people all around the world, also allowing remote healthcare with tests could be run by not by medical doctor but by nurses or so on. In addition to this, it opens also other opportunities because the system, instead of requiring to store sample, ship sample to a centralized lab to make the analysis, could be used to collect data directly on site, for example, in cohort studies, and is also a potential opportunity for other research tools and expansion to other conditions, as it could also be used for screening other system or other problems like infectious disease, autoimmune disorders, drug screening, cancer, but also in other fields than the medical field. I mean, veterinary is of course another application, but can also be applied for screening pollution and contaminants in water, as an example. So this tool has quite some high potential. And what's next? We are actually looking for continuing advancing this technology for allergy screening or other application. And if you're interested in this opportunity, please connect with us. So with that, I just have to thank the HEDIMED team and thank you for your attention.